好啊，明報㗎，想問下咧，因為而家
sorry，可唔可以大聲啲？
明報嘅，想請教咧，而家其實有幾多人咧喺院舍嗰度係適合接種，但係未接種嘅，同埋即係有冇信心嚟緊剩翻1個禮拜可以完成為呢一班人接種啦？同埋咧，而家即係之前院舍咧，其實都死咗過千嘅院友啦。前日咧先至成立呢個院舍新冠疫苗外展接種協調中心，會唔會太遲啦？另一條第二條咧，就想問翻即係西醫工會嗰度咧都話其實呢一個衛生署嗰度咧提供咗啲社署準備咗嘅院舍名單，但係有一啲其實已經有機構打咗針，有啲打咗去就話執咗粒咁樣，好混亂。咁其實係咪行政混亂令到個院舍個接種咁慢呢？另一方面都想問咧，其實而家已經200幾萬人打咗第3針啦，可唔可以解釋下嗰個社交距離措施？即係因為其實用梁萬年或者係另一位即係內地專家嘅所講嗰個精準方式咧，其實係咪真係唔可以放寬俾佢哋咧？如果再高啲嘅接種率同埋都同嗰個社交距離措施脫鈎，咁而家政府嘅立場係咪唔係維持追求呢一個嘅群體免疫嘅措施，定係已經即係承認喺 Omicron 底下其實係即係永遠都做唔到呢個群體免疫咁樣㗎？
我嘗試回答第3個問題，關於社交距離措施同疫苗接種嘅計劃，又請聶局長咧都係再詳細講講我哋喺推動院舍長者接種嗰度嗱。就社交距離措施咧，仍然係一個抗疫需要嘅手段嚇。好似我頭先講啦，如果大家翻看即係世界衛生組織有關於新冠疫苗嘅網頁咧，冇錯，佢話一個有效安全嘅疫苗咧係一個game changer 嚇，係可以幫助到我哋停止咗而家呢個新冠病毒嘅大流行。但係喺未完全達至嗰個階段嘅時候咧，仍然係用晒嗰啲其他嘅防疫嘅措施，包括個人衛生啊、佩戴口罩啊，同埋保持一定嘅社交距離啦。咁所以唔係一個簡單嘅話，當嗰個即係疫苗接種率去到某一個地步咧，就係可以完全放棄咗呢啲社交距離措施。因為疫苗接種最重要嘅效果係減低重症甚至死亡嚇。佢未必話會可以令到我哋整個社會咧係好安全，從而咧唔需要再有一定嘅社交距離措施。反轉嚟講咧，舊年喺第4波完結之後，即係話2021年嘅下半年，當時我哋嘅疫苗接種率都唔算好理想，但係我哋已經好大部分嘅社交距離措施咧都放寬咗噶啦嚇。咁所以簡單回答咧係需要一個綜合性嗰個考慮嚇。咁但係目前而家未係去到呢個階段，我哋仲係密切監察緊。而家我哋見到每日嘅確診數字加埋快速即係抗原測試出嚟嘅自己申報嘅數字，究竟香港第5波嘅疫情而家係喺個高峰嘅平台期啊，抑或仍然係仲會上升啊，抑或已經係踏入一個下降期咧？呢啲係暫時係太過早啦啊！要不斷咁監察。我早前亦都係2月22號宣布咗咧，睇嚟一系列嘅社交距離措施，同我哋嘅學校停止上課係需要大概延續到去4月20號到嚇。咁但係如果中間有個好理想嘅環境，讓我哋能夠重新審視有啲地方係可以放寬咧，我哋都努力會去做嘅嚇。請阿聶局長。好啊，
喺院舍接種嗰度，或者我解釋一下啦。第一咧就係我哋目前嚟講咧，喺1096間嘅安老同埋殘疾人士院舍當中咧，就最新嘅數字就係有4萬名嘅院友咧係已經接種咗第一劑嘅疫苗，咁個百分比咧係52%嘅。我哋現時個目標咧就係喺3月18號嚇，即係仲有個幾星期嘅時間咧，就係讓所有呢啲嘅院舍咧都曾經有呢個外展接種隊咧去到嗰度接種疫苗嘅。咁目前嚟講咧，就經過咗即係努力啦，而家剩低咧大約有130間嘅院舍咧係即係要安排外展隊咧嚟去接種呢個疫苗。咁具體嚟講，究竟到最後喺整體上大約有78000名嘅院友當中，有幾多人係合適接種疫苗， 或者有幾多人呢一刻可以接種疫苗呢？呢個呢都係要等到我哋完成咗呢個階段呢，先至能夠可能掌握清楚。因為呢就一直以嚟呢，就尤其是最近呢，就啲院舍都有爆發，咁所以變咗有一啲感染嘅長者呢，佢哋感染咗之後呢，喺呢一刻呢就未可以打針住嘅。但係佢哋康復咗之後呢，亦都係一段時間呢，就係要打針嘅。咁所以呢，我哋呢一個嘅做法呢，3月18號係一個階段，去完成個目標呢，就係所有嘅院舍都有外展隊呢係去過接種疫苗。但係跟住落嚟後做嘅功夫就好多嘅，就要繼續喺呢一啲嘅院舍裏邊呢，一啲可以打第2針、第3針嘅呢，陸續再繼續有外展隊咧嚟去做。咁所以嗰個計劃呢係咁樣。第二呢，就係其實有關啲工作一路都係進行緊嘅。當中牽涉到當然主要就係社署同埋衛生署同個院舍之間嗰個嘅協作咧，同埋就係外展隊嘅醫護團隊個協作。咁就尤其是喺嚟緊，即係尤其是喺就係最近咧，亦都睇到嚇，即係呢一方面嗰個聯繫協調咧係好重要。亦都有頭先你所講到嚇，可能啲名單嗰啲咧又唔係最更新。或者醫護團隊打到去院舍嘅時候咧，院舍接收嘅信息咧又覺得我爆緊喎，咁你醫護團隊唔好嚟啦咁樣，或者如此種種好多呢啲嘅問題。咁所以咧就我哋採取個嘅做法咧，就係所有嘅醫護團隊咧都有一個社署嘅同事就去跟住，咁亦都透過協調中心咧有社署同衛生署嘅同事喺度咧，就即係直接聯繫嗰啲院舍。當啲醫護團隊去到院舍門口發現有任何問題嘅時候咧，佢即刻可以咧係即係話翻俾我哋聽，咁中心嘅同事咧就直接同個院舍聯繫，同個醫護團隊聯繫，咁就解決呢啲嘅問題。咁而事實上咧就呢幾日嘅運作咧都係即係睇到嗰個嘅成效，亦都係方便到醫護團隊咧佢哋去上去院舍嗰度打針，亦都更加清楚地將個信息咧係讓院舍咧嚟去知道。亦都對一啲院舍一啲嘅要求咧，都係講得清楚嚇。咁所以咧，我相信呢樣嘢本身都係重要。所以個做法係點樣？我哋會因應實際嘅情況，有需要加強就加強，有需要用啲特例啲嘅方式去處理，就用第二啲方式去處理。咁係一個咁嘅情況嚟嘅。
好，第3位記者嘅2條問題。Yes, the gentleman at the back.
Good morning, Mrs. Lam. A new HKU study by Ben Cowling and Gabriel Leung has shown that the ban on dinner dining services had no noticeable impact on reducing transmission during the 3rd and 4th wave of COVID. Would your government consider to lift the dine-in ban in light of the new findings? Second, if an arriving passenger tests positive at the airport and then negative on rapid tests on day 6 and 7, they're free to go. But if they test negative all along, they must do the 14 days quarantine. What's the logic and will that be rationalised? Why not shorten the inbound quarantine to 7 days, freeing up hotel space for isolation facilities? And finally, the government has blamed people with ulterior motives for the recent panic buying. Yet there were U-turns and over lockdown and officials leaking details to the press almost daily, perhaps trying to gauge reactions, but causing confusion and chaos. Government sources say this and that. With lives at stake, should the government get a grip of their ministers and speak on record with one clear, unified voice? You said communication will improve. Can that be part of it?
Which organization are you from?
Hong Kong Free Press.
Thank you.
Of the 3 questions, let me answer them one by one. First is I was also a bit surprised by this study quoted in some of the newspapers done by the Hong Kong U team. As you know, throughout the 2 years of fighting the epidemic, we have been working very closely with the universities. We have been funding a lot of research and studies and vaccinations and so on carried out by the university. So I got this clarification from Professor Gabriel Leung this morning that the report about the dine-in ban for evening had no effect whatsoever on suppressing the epidemic and the spread of the virus has been taken out of context. Because I have not read the full report, but I got this clarification from Gabriel, and he categorically told my colleague that we could quote him, that that statement was taken out of context. Actually, if you thought through, it's not quite logical. If we don't allow people to come in a restaurant, that must have a better effect than allowing people to come in, take off their mask, and then have the meal together. So that's point number one. Now, point number two, actually, I do appreciate the sort of frustrations of some of the arrivals from overseas. While we are adjusting our own quarantine and isolation policies, and also introduce a discharge criteria by the Center of Health Protection that will enable people under quarantine or under isolation to be discharged after 2 repeated tests on day 6 and day 7. But we are still adhering to the same quarantine arrangement for inbound travelers. I did explain it yesterday to another similar question. This is because of the risk that we must ensure that we will not impose further on the hospitals. As I said, I can understand the frustrations, but at this moment, Hong Kong is facing an unprecedented epidemic. So at this point in time, my first priority is to ensure that we could protect people in Hong Kong and also protect the public hospital system. So to make any relaxation of for arrivals, which will run any risk in those respects, is not something the Chief Executive would like to see. But I did say that after this wave subsides, we will take an overall look at the border controls, particularly for inbound arrivals, particularly for Hong Kong people who are now not allowed to come back because of the place-specific flight suspensions. We will try to map out a pathway for resuming this travel for people who want to come to Hong Kong. Now, I could not readily accept your accusations on two fronts. One is the government was making U-turns on its anti-epidemic policies and practices. Second is government officials deliberately were leaking information to the media or to the public in order to gauge reactions. Now, on the first accusation, my response is like this. This is an unprecedented situation. In terms of responding to an epidemic of this magnitude, it has outgrown the normal capacity of the Hong Kong SAR government, or actually outgrown the capacity of Hong Kong. Where do we get all this manpower? Where do we get all these isolation facilities? Where do we get all these hospital beds? So in a situation like this, any adjustment in policies or in practices are to enable Hong Kong could cope with the situation as best as we could enable us to protect the public hospital system, but at the same time also to save lives. For example, we are now turning the Queen Elizabeth Hospital in a designated hospital to look after COVID-19 patients. If you asked me 3 months ago, that was inconceivable. Why should QEH become a dedicated hospital? So this could not be regarded as a U-turn. This is a timely adjustment in the policies in order to achieve the objective of protecting the safety and the health of the people of Hong Kong. I hope you understand that. Now, unless you can produce evidence that my senior colleagues or ministers were doing the deliberate leaking that you refer to, I could not accept this accusation. But never mind, from now on, 2 days ago, I started this daily press conference. So I am the authoritative source of anything that the Hong Kong SAR government is doing in this fight against the epidemic. I would suggest that if you have any queries, you come to these daily conferences, you ask me, I give you a direct answer. But don't accuse my ministers. My ministers are all working very hard in fighting the epidemic. But I do see some leakages, but I could not trace the source of those leakages. I could tell you that I am as frustrated as some of you when there were government information being leaked out, which should not be the case. And we will be as open and as transparent with the people of Hong Kong in order to instill the needed confidence in taking Hong Kong out of this major public health crisis. Thank you.